delay.
We're waiting for the countdown. In 5, 4.
Good morning and good afternoon, everyone who are watching us now. My name is Alexandra Kuzmanovic, and I work in the Department of Communications in the World Health Organization headquarters here in Geneva. It's my great pleasure to have a conversation this morning with our lead expert on COVID-19, Dr. Maria van Kerkhove. And I'm also happy to say that we'll have these regular weekly conversations with her where you can ask your questions and anything you want to know more about the COVID-19 response and how to protect yourself and your loved ones. We are running a bit later than we planned this morning, Maria, so can you tell us what was your previous assignment and meeting before this today?
Thanks, Alex. Hi, everyone. And thanks for the chance to do this and to talk regularly with different people all over the world. So yes, I'm sorry we're starting late. This is my fault. I'm actually running late coming from a different meeting. And every morning we have 2 meetings that we start with. The first is what we call our incident management meeting, which is essentially how everybody involved in the COVID response here in headquarters in Geneva, the same meetings are happening in our regional offices and in our country offices. But in Geneva, we meet every morning at 8 in the morning and we discuss the situation of what we're in, as it relates to everything related to the response. So we have different pillars of work, whether it's related to communications, whether it's related to guidance development, supply chain management, the development of diagnostics, therapeutics, vaccines, research and development. And we just touch base every morning on what are the priorities of the day, what do we need to be doing, what does everybody else need to be aware of. And then at 9 o'clock every morning, we have a meeting which is called our acute event management, which is where we discuss all of the outbreaks and all of the humanitarian events that are happening globally every day. So COVID-19 is one of the many events that are happening. That there's an Ebola outbreak that's happening as well, but there are other things that we're monitoring. And I think it's important for the world to know that WHO is continuing to monitor all of these other alerts as we deal with the COVID pandemic. And on Wednesdays, we go into this deep dive into COVID in very particular aspects. And so different parts of the team will present what do we know about and what are we learning about each of these different elements. So that's why I'm late.
Thank you, Maria, and thank you for explaining to our viewers how your morning looks like during this outbreak and for many of our colleagues around the world. We're 6 months into this pandemic and we see that the number of cases are growing continuously. What can we do to change the course?
So that's a good question. We are 6 months in to this pandemic, and if you look globally, the case numbers are increasing, but that isn't a consistent picture across the entire world. In several countries, they have had success in controlling the outbreak and controlling this virus and bringing transmission down to a low level. There are other countries that have this sort of steady state, and they're still seeing case numbers being reported every day. And in a number of countries, we're still seeing an acceleration. And so there isn't that consistent picture over the world. And it's something that is quite concerning because we are seeing the epicenter, where the most active transmission is, shift around the globe. And right now, most of the transmission is happening in the Americas. And that is quite concerning because we are seeing some very large increases in growth. But there's a lot that we can do. And I think that's what is important. Even 6 months in, I know many people are tired of this and they want it to be over. And we feel that as well. We all want this pandemic to be over, but we still have a long way to go. And what we are learning from countries who have had success in transmission is that there are a number of things that countries can do, and there are a number of things that you as individuals can do to prevent yourself from getting infected, and also to prevent, if you do get infected, to passing it on to somebody else. And so I think that's what we're gonna chat about today. What are the specific things that countries can do? But I want people watching to know that there's hope. And that many countries, not just 1 or 2 or 3 countries, but many countries have had success in bringing these outbreaks under control.
Thank you, Maria. Thank you very much. I just want to invite our viewers who are watching us on Twitter to ask your questions by using the hashtag AskWHO. If you're watching us on Facebook, TikTok, or LinkedIn, please leave your questions in the comment section, and also tell us where you're watching from. Maria, you said there are things that countries can do, and that some countries already have seen the success. Can you tell us what are these actions that countries can do to stop the transmission?
Yes, so we have outlined a comprehensive set of measures from the beginning of this pandemic of what countries can do. The first of it starts with an all-of-government and an all-of-society approach. And what that means is that this is not just a health issue. And so when we say an all-of-government approach, it means you have to bring in all of the different sectors and have very strong political will and leadership and having a clear national plan. When we say an all-of-society approach and we talk about the community, it means informing, educating, listening to, and empowering the community. You have a role to play in this. It's not just government leaders, it's you as well. We mean having good surveillance to be able to detect cases, to be able to find cases, isolate cases to make sure that they don't have the possibility to transmit to others, care for those cases in specific facilities depending on the severity of their illness, making sure they have good clinical care, making sure that health workers are protected from infection when they care for suspect and confirmed patients. It means that we have good diagnostics so that we could find those cases. It means we have contact tracing in place so that from all of the confirmed cases, we find their contacts, we identify them, and we follow them over 14 days, and we put them in quarantine. So that they don't have the possibility to transmit to others should they be infected. It also includes making sure that we have our essential medical services in place so that not only are we dealing with COVID, but we're also dealing with people who need to be cared for other illnesses, because there's a lot of other illnesses that are out there like cancer or diabetes or other chronic conditions, and a number of other factors. We call these public health and social measures that are put in place. And if you're where you live, if there's active transmission, you may be asked to do certain things like stay home, or these stay-at-home orders, or wear a mask, or anything else. It's important that you follow those recommendations by the leaders, because the implementation of this has to be done at the most local level as possible to have the biggest impact.
Thank you, Maria. And we're already receiving a lot of questions from our viewers. Thank you very much. I'll start with first that it's coming. A few people from LinkedIn are asking, is it a good idea to reopen educational institutions if there is a huge gap between infections and deaths in a country?
So that's a good question. So there are a lot of questions right now about opening schools and what we're advising around schools. And in fact, in lifting any of the measures that are put in control, it has to do with where this virus is circulating and how intense the virus is circulating in that area. If you have community transmission, if there's a lot of circulation in that area, we are advising governments to take a look at that and see if it's the right time to actually lift those measures. That also includes schools. We need to be able to control transmission in the community before we start to open some of these things up, because if the virus is in the community, then it'll be able to enter different places like schools or like workplaces. And so we've outlined some considerations for governments to take into consideration for when and where public health measures can be lifted, but the lifting of these measures needs to be done in a slow and in a steady and in a staggered way. It can't be done in a country all at once. We need to look at where the virus is and see if it's controlled in a specific area, then maybe some of these measures can be lifted. But I do think it's important to warn everybody that it is a dynamic situation and it's evolving very quickly. And so in some places, if the virus has a possibility to resurge, we may have to put some measures back in place, or governments may need to put some measures back in place. But what we're hopeful and what we're learning from countries is that they may be able to do this in a very small geographic area where it's really, really needed and for a temporary amount of time.
Thank you, Maria. you said this is a whole of government and a whole of society approach. Can we unpack a bit what are the different roles that we can play if we are part of a government or if we are health workers, other essential workers? So what are different roles people can play to help the response?
Well, let's start with health workers because I think all of us here across WHO and all over the world are so grateful for the work that healthcare workers are doing and health workers and communities and caring for people. And really, we are so grateful for that. And health workers need to be trained so that they know how to deal with infectious diseases and respiratory diseases and COVID-19 in particular. We need to ensure that they have the right personal protective equipment so that when they are caring for patients that they have the right gloves, gowns, masks, all different types of personal protective equipment so that they are protected from infection. And I think that we also need to ensure that they have adequate rest periods, and we know that people are working tremendous shifts and they're working very, very hard, so we need to be able to support them. I think on an individual level, there's a lot that we can do. I've seen tremendous amounts of kindness from everyday people who are supporting health workers. When I was in China in February on that international mission, one of the things I was most touched at was for the health workers that were working these long shifts, we saw people that lived near them buy groceries for them or help take care of their kids or help clean their house. And I was really touched by that level of kindness. And I think all of us can support our health workers and also our essential workers who can't stay home, who are doing working in all of the different client-facing and businesses that keep our economies going, and working in the grocery stores and working on public transport. We also are so grateful for the work that you're doing as well. And teachers, and I could go on and on, but there's a lot that all of us can play. In terms of individuals, I think what I would like to emphasize is that we must remain vigilant. We really need to be wise and we need to be alert. And what I mean by that is really know what the local situation is where you live and where you're traveling if you have to travel. And please know what you need to do to protect yourself from infection. We hear a lot from young people who say, well, it won't be severe for me. Maybe I'll just have a mild disease. But we do know that people who are young can also have severe disease. And if you get infected, you have the possibility to transmit to somebody else who may be in a vulnerable population, who may develop more severe disease and may die. So it's very important that you adhere to all of the public health measures that are put in place.
Thank you very much, Maria. We are receiving more questions from our viewers, so I would pass some of those. One of the questions is from Lena. Can you give a reason why is coronavirus spreading so fast?
So, Lena, thank you for that question. So this is a respiratory pathogen, and this virus likes people. It lives in us, and it needs people to infect. So if we provide this virus with an opportunity to pass between myself and someone else, meaning if we're in close distance to one another, if we're in crowded spaces, we will allow, that virus will like that, and that virus will transmit to other people. And so in many situations, we've had these kinds of events where the virus has been able to spread readily between people. The good news is that if we implement physical distancing, and I think Alex, we've changed, we're not saying social distancing, we're saying physical distancing, because we want people to be distant from each other but remain socially connected, because that is absolutely critical, and I hope we can touch upon that later. We need to ensure that if you're feeling sick, if you're feeling unwell, you stay home. You call your medical provider or the hotline that's in your area to find out what next steps are. Depending on the symptoms that you may have, you may need to seek care immediately and get tested. Making sure that you clean your hands and that you don't touch your face. This is a really important one because if the virus is on your hands, you can kill it if you clean them. And if you don't do that and you touch your eyes, your nose, or your mouth, you can actually infect yourself. It means wear a mask where appropriate. So in many situations where you cannot do physical distancing, it's important to wear a fabric mask. And it just, as much as you can, find reliable information. There's a lot of misinformation, there's a lot of disinformation out there that's false, that's really quite damaging. So go to reliable sources. If you're young, talk to your parents, find out where you can get good information about this virus and how to protect yourself.
Thank you very much, Maria. Yes, you mentioned we need to practice physical distancing, but to be still socially connected. So is there something we can advise people to do, how better to cope with COVID and with living in the time of pandemic?
I think this is important, Alex, because this is a really challenging situation for everyone. Wherever you live in any part of the world, this is very difficult. And I think it's okay for us to acknowledge that. And I think it's important that we talk about it because some people may be sad, some people may be scared, some people, we need to acknowledge that. We need to find ways to get good information, and we need to find ways in which we can connect with other people, especially people who are living alone. I know that there are many older people who are living alone. So the good news is that there is technology that does exist all over the world in which we can remain socially connected. So check in on your family, call your family regularly. I know in my family, we do a lot of FaceTime and a lot of Skype and a lot of Zoom where our family remains connected, and we touch base with one another to check in. If you're living in an area where you have neighbors that are alone, stay physically distanced from them, but check on them and see how they're doing. I think that we need to find ways to cope with this because we have a long way to go. So acknowledge that sadness and that fear, but turn that into something positive. Turn that into ways where you can support your neighbors, you can support your loved ones, and try as much as you can to remain socially connected with your loved ones, with your friends, with your family. And if not, also do things at home. Read a book, listen to music, watch television if you can, go for a walk in areas where you can. Do the things, find the things that make you happy. There are things every day that can make us happy, even in the most challenging situations, and really try to make something happy every day.
Thank you very much, Maria. This was really, really helpful and really important to say repeatedly every time we have the opportunity to talk to our viewers. Here is the next question coming from TikTok. Can we catch COVID-19 for the second time?
So this is a good question. We're getting this question quite a lot. We don't have a full answer to that yet. What we understand from people who are infected is that they will develop an immune response. They will develop some level of protection. What we're trying to understand, and when I say we, I mean scientists all over the world. So these are people who are really actively looking at this. We want to better understand how strong that protection is and for how long that protection will last. We do have experience with other coronaviruses. There are MERS and SARS, in which people will have some level of protection for a year or more. But we also have these human coronaviruses that circulate regularly, the common cold, in which protection is shorter lived. So we don't know the full answer to that yet, but it is possible that people may be able to get infected a second time in the future. So we're actively working with scientists and trying to accelerate that research so that we have a better answer to that question. Yeah.
Thank you very much. Anna from LinkedIn is asking, is the pandemic going to be worse in autumn?
So that's a good question. So there's a lot of questions we get around seasonality, meaning in the northern hemisphere, will it come back in the winter like you see with influenza? What we're actually seeing with this virus is that whenever it finds an opportunity to transmit, it will. So it doesn't need colder weather to do so. We've seen in a number of countries that have colder weather or warmer weather, and even in the southern hemisphere, countries that were successful in bringing transmission down to a low level are starting to see some of these outbreaks. And what I mean by an outbreak is it's outbreaks in certain settings. In Singapore, we saw this in dormitories where people live in very close quarters. We've seen outbreaks in long-term living facilities. We've seen outbreaks in meat processing plants. And you don't need the autumn for that to happen. So we need to ensure that when I say remain vigilant, it means all of these measures that are put in place, we need to adhere to. Especially in the northern hemisphere where summer is happening, people want to get out and about and socialize and do different things. I appreciate that and I understand that and I want to do that as well, but we still need to remain vigilant. Stay physically distanced from people. Please avoid crowds, and think about the things that you need to do, the things that really need to be done as opposed to the things that you really want to do. And let's find other ways for now. We're going to have to figure out what this new normal looks like. There's no going back to sort of the everyday life before this pandemic for the time being. And we need to make sure that we are smart about all of the activities that we do as individuals, because we have control, over the decisions that we make. So please make some good decisions about the things that you and your family are deciding to do.
Thank you. Thank you very much, Maria. Here is the next question coming from Patrick. Junior, after recovery, can the patient still transmit the virus to others?
So Patrick, that's a good question. So we're learning more about how long people are infectious, which means how long they can transmit to others. There's some preliminary data on this from some labs. It's a very small number of studies that are looking at the number of days that people can transmit to others. It depends on how severe your symptoms are. The more severe your symptoms are, the longer you could be infectious. But after people generally recover, they're not infectious anymore. I can't give a hard stop on how many days that is yet. We did publish some scientific literature on that, and we can refer you to our website. But this is an evolving science, and we're learning more every day. But after people recover, they're generally not infectious. And so that's why there's criteria that we provide to hospitals and to decision makers about when people should be released from isolation.
Thank you very much, Maria. Some of our viewers are saying that their countries introduced strict lockdowns, and after the lockdowns were lifted, they see big increase in cases. So they're asking, what should be the next step to stop the transmission? What should they do now?
So what needs to be done always, we are seeing this in a number of countries that are lifting some of these measures. We're seeing this resurgence, we're seeing some outbreaks. Countries need to implement this comprehensive package that they put in place. So many countries have used the last 6 months and some even before that to really build up their workforce, to build up this public health infrastructure that we say, which essentially is the surveillance systems in place to find cases, isolate cases, the testing systems to be able to test for cases, the medical facilities to be able to care for cases, quarantine facilities or guidance for home quarantine to quarantine the contact, put that in place. And really to act rapidly. We are seeing countries that do see this resurgence. If they act very quickly and they're able to detect these early cases quickly, they can control those outbreaks from becoming something much, much bigger. And that's what we're hoping for. We are hoping that countries do not need to implement these nationwide so-called lockdown measures, because they have tremendous social and economic impacts as well. And so that's never the goal, to be able to, to have to do that. And so we're hoping that countries can really quickly identify these clusters and bring those under control quickly.
Thank you very much, Maria. Here is another question on symptoms. How long can it take for symptoms of the virus to show up after being infected?
That's a very good question as well. So most people, after they are infected, develop symptoms around 5 to 6 days after they were infected. It can be up to 14 days after that, but most people around 5-6 days.
There is another question from Ismail from Turkey. Why not more than 14 days?
Well, there's always exceptions to that, but most people, so we call this the incubation period. So most people develop that within the first 5 to 6 days, and then up to about 14 days. Yeah.
Thank you very much, Maria. Some people are asking why you and I are not wearing masks. So would you please explain what is our recommendation on when we should wear masks when we are indoors?
So WHO has advised on the use of masks as part of a comprehensive package of measures since our first guidance was issued on the 10th of January. And we separate this out between masks for health workers and masks for the general public. So for masks for healthcare workers, we've always advised on the use of medical masks and respirators in situations where they're doing these special medical procedures in healthcare. For the general public, we've always recommended the use of medical masks for people who are sick. But if you're sick, you should be at home. I do want to emphasize that. And for people who are caring for people who are sick. We've also updated guidance on the use of masks for the general public for situations where you can't do physical distancing, where you can't do at least 1 meter apart. And the more the distance, the better, but at least 1 meter apart, and especially in areas where you have what we call community transmission, which is just a phrase that means where you have active circulation of the virus. And we also advise people to avoid crowded indoor settings if possible. And if you can't, then put a fabric mask on.
Thank you very much, Maria. Thank you everyone for your questions. We are running out of time, but as I said at the beginning, we will have weekly Q&A live with Maria when you will be able to ask more of your questions. Just before we close, would you like to summarize as well what we as WHO are doing to support countries to limit the transmission of this virus?
So thanks, Alex. So we are working to support all people everywhere, and in particular governments and ministries, to be able to develop these national plans and implement these plans about how to prevent, to be ready, and to control these outbreaks. So this involves the development of guidance and advice to governments, and then supporting them in the implementation of this guidance, whether it's for clinical care or for finding cases or for caring for cases or for laboratory testing or for essential medical services. I could go on, and also how to help empower communities so that they know what role they have to play. We're also supporting governments in making sure that they have essential supplies. So whether it's related to personal protective equipment or diagnostic tests or oxygen, because we know, even providing respiratory support to patients can save lives. Everything that we are doing is really focused on 4 things. One is to ensure that we support leadership to be able to implement these plans. The second is to have empowered communities so that everyone knows at the community level, at the individual level, what they and their communities can do. And then the last 2 is around suppressing transmission, so breaking these chains of transmission and saving lives. There are tools that we have right now that can break chains of transmission and that can save lives, and we're working with governments to be able to apply all of those tools everywhere we can to save as many lives as we can.
Thank you very much, Maria. Thank you for your time and for your effort as well to spread the word and share the advice and knowledge we have to everyone around the world to be safe. I would like for the end to say thank you everyone for watching us from Indonesia, Saudi Arabia, Philippines, France, Norway, Egypt, UK, Thailand, Belgium, South Africa, Nepal, Vietnam, Israel, Australia, Angola, New Zealand, Japan, Serbia, Zimbabwe, Rwanda, Tanzania, Pakistan, Korea, Peru, Sri Lanka, Iraq, Ghana, Ireland, and many others. Thank you for your time, and we will be here with you next week again. Until then, stay safe, please.